Migraine headaches are classified as a disease, according to the American Migraine Foundation, and any sufferer will no doubt agree. They impact more than 1 in 7 people globally. So we asked our natural medicine doctor, Christina Captain, for help on how to feel better. Great to see you.
Good to see you too, Stephanie, as always. Love being here.
So I love learning about things that really affect people's lifestyle and well-being. Explain like an official definition of what is a migraine. What makes it different than like, oh, I have a headache?
Yeah, so first of all, there's chronic migraines and acute migraines, but migraines are typically unilateral on one side of the head. Sometimes they can be on both sides, but most of the time they're on one side, definitely maybe behind an eye, and appearing in sort of like a throbbing, constant manner. The other thing that you can have with it is numbness and tingling, kind of an anxiety, and also nausea and possibly vomiting. Can interfere with all aspects of your daily life.
I mean, even a light headache can be annoying to any of us on a daily basis. So to have it, first of all, be stabbing pain and then reoccurring and chronic is definitely tough. No, I mean, I'm lucky in that I can't. So when people come to you and say, I'm a migraine sufferer, where do you begin? How do you start approaching that?
But first of all, we want to know that they chronically affect women more than men, right? 1 in 5 women, 1 in 16 men.
Wow, is it hormonal?
Of course.
Isn't it always?
Everything about women is about hormones, right? So a hormone issue can be a trigger. So when we think about headaches or migraines, we think about it in 2 separate sections in terms of coming to my clinic and getting assessed for it. We look at structure first. Is there a structural problem, like an injury? Do you have a problem with your cervical spine, which is the spine of your neck, right? Do you have a problem with your posture? Are you constantly on the computer or texting down, looking down? Are you spending a lot of screen time? Could it be your eyes? So we're looking at issues that might be structural in nature or anatomical in nature versus triggers in nature, like hormones are a trigger. Foods are a trigger, like caffeine and red wine, right? Sleep is a trigger, not getting enough sleep, right? Oh man, can't sleep. Oh, I got a migraine today. It's really debilitating to me. Can't think, can't see, can't work, can't be a mom, can't be a dad, can't be a lawyer, can't be a doctor, can't be a surgeon, have a migraine. So a lot of that is where it comes in.
And obviously a lot of lifestyle impact. Is there a reason, especially in terms of medically, why it's so important to identify that it's a migraine? So
the thing is, migraines can indicate something more foul, right? So we want to make sure that your brain is clear. You want to make sure that you're not having any major issues that a primary care or a neurologist can rule out simply. So if a patient comes to us and they haven't been seen by any other allopathic or conventional care practitioners, we want you to go. We want you to integrate. One of the specialties of our clinic is that we integrate Eastern medicine and functional acupuncture with allopathic medicine, with conventional care. And in that way, we can work with their primary care practitioners or their neurologists to see what we can do to make the best outcome happen. So imagine this, no physician wants you to be on heavy drugs. They don't want you to go on anti-seizure medications because you have migraines, right? So instead of that, let's try all these other non-invasive or more, easy peasy modalities like physical therapy, chiropractic, acupuncture. Of course, acupuncture is amazing for it. Before we go to the big bag drugs, we know they're there and we're so happy for that. We want you to make sure that you have nothing foul going on, nothing major that needs attention right away. Then we want you to come in, we're going to assess you. Is it structural? Is it a trigger? Food, hormone, lifestyle, right? And then we're going to treat you for that. One of the real things, I'll tell you a story. Had a patient come in, major migraines, new mom, couldn't handle dealing with her newborn because the migraines were so severe. Right? Okay, so we run just a basic chemistry blood panel on her, and we find that she has a really low level of certain nutrients. Those nutrients we replete, give her a little calming acupuncture to balance all of the hormones and stress from being a new mom. Bam, migraine's gone.
Oh, that's amazing.
Right?
And I love the fact that you are working in conjunction with our primary care and other doctors, because it's important to have the MRI to rule out anything funky and scary. Once we rule that out, though, how wonderful is it to be able to have a natural medicine approach without taking those scary drugs? I'm sure that new mom didn't want to be on big old pharmacology drugs.
And could she breastfeeding?
Probably not.
So, so that's the whole thing about medicine is like, can you take a medicine that's going to help you now and hurt your baby later. I mean, or at the moment. So we really have to pay attention to who the individual is, what that individual problem might be, and then we can fix it, hopefully in a non-detrimental way or a non-invasive way.
And you said hopefully.
Yes.
This really is about hope, because I feel like for migraine sufferers, day in and day out, you're like, wow, my life is miserable.
Right, exactly. So if you have a migraine, if you have chronic migraines, chronic head pain, chronic headaches, come and see us. We are your hope. We can do it. We can help you.
And it isn't about big scary drugs or anything else.
Right.
We can look at these natural solutions first. All right, love the story and love the hope that you give. For more information about natural medicine solutions for many different problems, including migraine pain relief, you can find Dr. Captain and her team by going to scansrq.com. We'll be right back.